Hey Jessica, it's Heather. I thought I'd take a minute to respond to your discussion board. I enjoyed reading it. I really love how you point out, the specific barrier that primary care teams feel overburdened by their workload and refuse to accept the introduction of new mental health policy plans and programs. I think, when you're looking at, primary health care, people, it's already talking so much in the textbook, right? In our global mental health textbook about you've got healthcare workers that are leaving the lower to middle income, and moving to the higher income, patients to work with. They're overloaded. The amount of people that they have there compared to the population that they have compared to how many people are working. I know my group is finding, in our country that we're studying in East Asia, about the fact that there are so many limited healthcare workers, let alone any kind of mental health care workers. I even found statistics on the country that we're studying, like 2 people were there. 2 psychiatrists even in like the 1940s, so think about how the population continues to grow everywhere and the amount of people, that they have. So you've got all these resources and all these policies that you're trying to create. And what I love is the barriers that that the World Health Organization explained, and how much in detail they went to not only just the barrier, but how to help resolve it. I'm really glad that they even set forth those steps, and then the paragraphs beyond that just even explain it more, right? That we're going to, like you said, need to create incentives. Like, think of things that would motivate the primary care teams, because like you said, they're struggling, and giving them more motivation to continue and remember why they started. So talking to them, seeing the needs that they have, and hopefully being able to provide them. We all know what burnout is. We all know, especially in social services and healthcare and everything, the burnout rate, is significantly higher. So, just educating ourselves on what causes burnout, how to prevent it. So, I think this is a very good barrier, to discuss. I think you did a really good job of just talking about spend time with a primary healthcare worker, see what needs they need to have met, and like you said, creating incentives. All these things are going to help reduce these barriers, and more policies are going to be created. I love how the World Health Organization is working on just creating more policies and making everyone more aware of mental health, especially when it comes to those lower to middle income countries compared to higher. And as our textbook is talking about, those are the countries that at times will need more help because of their lack of resources too. I hope that you're having a good week. I'll see you in class on Thursday. Thanks.